Welcome to Registered Nurses Empire. There are 10 practice questions. You have 10 seconds to answer and check rationalization. Good luck. Employees from two different departments disagree with their respective departments over the transfer process. What is the best way to deal with this disagreement? 1. Set up a meeting of staff from the two departments to identify key issues. 2. Arrange for the managers from the two departments to determine a solution. 3. Allow the staff to handle the issue on their own without authoritative interference. 4. Ask the director of nursing to establish a policy.
Three, two, one.
The answer is 1. Set up a meeting of staff from the two departments to identify key issues. Remember, functioning as a democratic leader is best in this scenario. Employees dealing with the daily issues of direct client care have the best understanding of the situation and should have the autonomy to solve problems. Question number 2. The nurse is taking care of a 16-year-old male patient diagnosed with schizophrenia when his parents ask about the exact cause of their son's condition. Which of the following statement by the nurse is correct? 1. There is a possible brain damage that is why your son is suffering that condition. 2. Until now, there is no known exact cause of the disorder. 3. Impaired coping mechanism is the #1 cause of schizophrenia. 4. Genetics combined with improper nutrition can lead to schizophrenia.
Three, two, one.
The answer is 2. Until now, there is no known exact cause of the disorder. Question number 3. The wife of a client with suicidal ideation is to be discharged today. The wife asks the nurse about what she can do if her husband will attempt to harm her. Which response by the nurse is appropriate? 1. No need to worry. He's in good condition now. 2. Call the local authorities if that happens. 3. Address the concern of your husband. 4. Can you tell me some patterns or cues of your husband that may lead to harm you?
Three, two, one.
The answer is 4. Can you tell me some patterns or cues of your husband that may lead to harm you? Remember, the nurse needs to gather enough data about the client's suicidal ideation to prevent the spouse from getting harm. Question number 4. A major disaster has occurred, and nurses have flown in to assist with the large influx of clients. Which client is most appropriate to assign to the floating nurse from the mother-baby unit? 1. A male client admitted to hearing voices commanding that he kill himself. 2. An elderly female client who has herpes zoster. 3. A female client in pelvic traction who is 3 months pregnant. 4. A male client 1 day post-hemicolectomy with Foley catheter.
Three, two, one.
The answer is 4. A male client 1 day post-hemicolectomy with Foley catheter. Remember, provide clients with floating nurses who can utilize the skills they normally use. The patient who has a Foley catheter 1 day after a hemicolectomy is similar to a cesarean section patient. Question number 5. Which of the following is an example of a staff nurse working in an informal leader's role? 1. Attending a hospital-wide policy meeting. 2. Encourage a peer to join a committee. 3. Filling out a discipline form for a nursing assistant. 4. Verifying adequate staff coverage for a shift.
Three, two, one.
The answer is 2. Encourage a peer to join a committee. Remember, a leader does not always have official authority and power but influences a unit's success by being an outstanding role model and guiding, promoting, and facilitating professional growth and development. Question number 6. A 37-year-old male patient was seen in the emergency room telling the triage nurse that it was not his intention to kill his younger brother. A voice telling him to execute the action. Which of the following signs best explains the situation? 1. The patient is having a positive sign of schizophrenia. 2. The patient is suffering from a negative sign of schizophrenia. 3. The patient is suffering from a traumatic event. 4. The patient is having withdrawal of a certain drug.
Three, two, one.
The answer is 1. The patient is having a positive sign of schizophrenia. Question number 7. During a group session, a client with antisocial personality disorder tells the group that he wants everyone to praise him, otherwise he will harm those who will not follow. Which of the following intervention is a priority action? 1. Set limits. 2. Transfer the client to another group session. 3. Talk privately to the patient after the session. 4. Administer sedatives to contain disruptive behavior.
Three, two, one.
The answer is 1. Set limits. Remember, the patient may cause violence and harm to others. Question number 8. Which of the following statements, if made by the registered nurse, reflects that she has properly delegated a task to the nursing assistant? 1. Take a tympanic temperature for Mr. Green in room 515 at 5 p.m. 2. Get Mr. Gray in room 414 up today. Thank you. 3. Advance the diet for Mrs. Smith in room 212 for lunch. 4. Please see if Mrs. Jones' pain is better in room 313.
Three, two, one.
The answer is 1. Take a tympanic temperature for Mr. Green in room 515 at 5 p.m. Remember, a specific task delegation is option 1. The other options involve or are too vague for judgment or evaluation. Question number 9. An RN, registered nurse, an LPN, licensed practical nurse, and a nursing assistant are part of the nursing team. Which assignment is most suitable for the RN to delegate to the LPN? 1. Suction a 1-day post-operative tracheostomy client. 2. Administer the morning daily medication. 3. Empty the Foley catheter. 4. Pass the dinner trays.
Three, two, one.
The answer is 2. Administer the morning daily medication. Remember, higher-level skills and stable, predictable situations should be assigned to LPNs. Unlicensed assistive personnel, UAPs, should be assigned lower-level custodial skills. Question number 10. At the start of the shift, the team leader notices that all of the 4 antibiotics for the client are still in the medication room. The first action the team leader should take is to 1. Notify the nurse manager of the unit. 2. Ask the nurse who cared for the client about the medications. 3. Return the medications to the pharmacy so that the client does not get billed. 4. Ask the client if he received the medications during the previous shift.
Three, two, one.
The answer is 1. Notify the nurse manager of the unit. Remember, the team leader should first attempt to clarify with the employees involved. The client would not be a precise source of verification for the medication. The handling of the supplies is a secondary priority in ensuring that the required medications are received by the client. Job well done, nurse.